First of all, can you give me an update on how Israel is dealing with the coronavirus crisis?
Thank you for having me. Where right now I have this picture of two racing cars in a car race. One is definitely the vaccine. We are moving forward very fast. We already have more than 1.5 million Israelis vaccinated throughout the country. The vast majority of them are people over 60. That was our criteria. Among those who are under 60, there are medical teams, police officers, first responders, and so on and so forth. On the other hand, unfortunately, I have to say that we are part of this whole outburst of the disease again, and we have numbers that are really terrible. In the last couple of days, we have about 8,000 new cases every day. Just to remind our viewers that we are a country of 9 million people, so the numbers are really huge.
Give us a sense, if you can, about how you have managed to roll out the vaccine program so quickly. You are the envy of the world at the moment. Countries are staggered at how fast Israel has got shots into people's arms. How have you done it?
You know, it's not a system as we see in some countries of a huge stadium with hundreds of booths there. People sometimes have difficulty, especially when we're talking about the elderly, to get there. In this case, it's nearly a door delivery for many of them. I'm slightly exaggerating, but it's close to it. Part of the problem used to be that the sets of the vaccine are 1,000 vaccines. That's what we got from Pfizer. We were managed through Israeli technology to split it into smaller sets with Pfizer approval. So now sometimes our paramedics or nurses are able to travel with a set of 50 to a very distant point without wasting one single shot.
When do you expect that you will have the whole population or enough of the population vaccinated to be able to return life to normal?
Very much depends on the response of the population.
So what are you saying? Maybe by April, by May?
April is pretty realistic for this kind of a number. But it will depend a lot on, no offense meant, but what is referred to as British mutation. We are suffering from it right now here. And there is no reason in the world to believe that the vaccine is not working vis-a-vis these new mutations, but it definitely influences the numbers.
You believe that the rise in the spike in cases in Israel is largely down to the British mutation, do you?
I can't say largely due to, but we think that is part of the problem. We found cases here in Israel, some of them, by the way, directed straight to people coming from Britain in the recent weeks. Some of them, people who have no connection whatsoever to England or traveling abroad or anything of the kind. So unfortunately, it's here. We do have to say for a fact that it's here.
When you were talking just now about the vaccine, you had a broad smile on your face. You must be one of very few health ministers around and governments around the world with a smile on their face at the moment. What advice do you give to countries around the world who are really struggling with the vaccination program?
Well, first of all, it's difficult to smile broadly when we have these numbers of newly infected. So I guess half of my face is smiling, the other half is still has a worried expression on it. But in terms of the advice, I would say what I already mentioned during our conversation: get it out there. Don't put a huge station in the middle of your capital and wait for people to come, especially when you're talking about population at risk. Try to get it out to, if not to their homes, then at least to their areas, to their suburbs, to their towns. Probably it will help. Many other countries, I spoke to some of my colleagues, including the British Minister of Health. I think that every country can find resources in this situation, how to use more and more people with the vaccine to get as close to the door of those in need of the vaccine as possible.
I want to ask you about the issue of the Palestinians, because clearly there has been some criticism of Israel that it is rolling out the vaccine in Israel, but in the West Bank and Gaza. And indeed, I think you live in an Israeli settlement in the West Bank, and yet the Palestinians do not have access to vaccines. Why is that? Why are you not helping them?
Well, I think that we've been helping our Palestinian neighbors from the very early stages of this crisis, including medical equipment, including medicine, including advice, including supplies. I don't think that there's anyone in this country, whatever his or her views might be, that can imagine that I would take a vaccine from the Israeli citizen and with all the goodwill give it to our neighbors. If, God willing, we will get to the situation where there will be nearly no demand in this country, we will be able to share. But having said all that, I'm very glad to hear information that the Palestinians are trying to take care of themselves. They, I think, also managed to strike some agreements with different companies. We will be more than willing to share our knowledge and to share our experience with them. As I've said, as far as the vaccine itself is concerned, we have many requests from many countries. We think it's quite natural to first and foremost take care of our citizens.
But to be clear, if there comes a stage where you have surplus vaccine, then you will be prepared to help the Palestinians on the other side.
We definitely will consider that, but as I've said, I sincerely hope that by that time, at least part of their population will be vaccinated by different vaccines that they are trying to purchase. If any other help will be needed, we'll offer it.